Whiff test, whiff test is used to diagnose BV, bacterial vaginosis. So how do we perform this whiff test? You are going to apply KOH to vaginal discharge. So that sample that was collected, you apply KOH, potassium hydroxide. So you are going to apply KOH. Okay, so it's very quick. They do it in the office. They want to identify the fungal infection. So that is what they do. KOH. KOH. So what they do is that they apply that KOH. If it's Wi-Fi test, it is going to be smelling fishy odor, and that will be BV. So when you apply that and it's smelling fishy, that like that fish odor, that is bacterial vaginosis. They also have another one they call KOH preparation, which is about the same thing, the same KOH. So they use the KOH too. Okay, they use the KOH too for for fungi. So you can use it to do BV. You can also use it to diagnose fungi. So when they use it to diagnose fungi, they are going to see pseudo hyphen and spore. Pseudo hyphen and spore. So that is telling you when we use KOH, they can use it for and they will find they use it for the pseudomonas, pseudo hyphen and spore. Okay, and if they use it in the case of a tinea versicolor, the KOH, they are going to see spaghetti and meatball. These are all the questions they ask on a KOH. So let me just include that one too. So if they do the KOH finding for Candida, what you are going to see is pseudo hyphen, like I mentioned. If they do it on tinea dermatophytes, they are going to see branching sepata hyphen. But the another most common one in the exam is tinea versicolor. They are going to see spaghetti and meatball. They always ask this question, what do you see? So spaghetti and meatball for tinea versicolor. Then we have another one, wet smear. So wet smear can help you to diagnose multiple infection. So what they do is they place the discharge, that vaginal discharge, they will place it with a saline, like a normal saline on a slide. If it's a bacterial vaginosis, you are going to see those clue cells. What did I say that are the clue cells? They're going to have large bacteria and few white blood cell. Or they can also have pseudo hyphen and spore if it's Candida, or they can have they use it for Trichomonas. So they can ask you a questions where we use wet smear. So three all of the following, or except where you can use the wet smear, wet mount. You will choose clue cells, which is BV, Candida, and Trichomonas. So those are the three places you can use wet smear. But I say that whiff test is just adding a KOH. Is different from wet smear. Wet smear is a saline that you added on the slide, like a normal saline. That one is different. But in this one, you added KOH on the sample and it's going to give a fishy odor. But when you do a wet smear, what you are going to have is the clue cells. And what are that clue cells? Large bacteria and small WBC. But if it is Candida, you are going to have pseudo hyphen and spore. Then if it is trichomonas, trichomoniasis, you are going to have trichomonads. And again, if you use the KOH finding, if it's Candida, you have the pseudo hyphen and budding yeast. If it's tinea vesicola, you are going to have spaghetti and meatball. So please, it's very important that you know all these things.